Do people who experience homelessness use emergency medical services at a high rate?
So again, this is a kind of a yes but answer. That so the answer is yes on average. If you look at a group of people who are homeless and look at their use of emergency services, meaning the emergency department and I guess hospitals, that on average the rate is much higher. I think that statistic uh, uh, overlooks the fact that there's a lot of heterogeneity in that utilization, and there's a small number of people that are very high users of healthcare. There's actually a significant number of people who are unhoused who are actually not using services more than average or at all. And so the reason that on average utilization of emergency services is high is because there's a larger than average group of people who are very high users, and those very high users are much higher users than even the high users in the general population. So I think that uh, the this is a situation where it's important not to generalize because there are some people who are not high users. And I guess the other thing that is important to, I think, keep in mind is that sometimes people assume that high use of emergency services is either overutilization or unnecessary utilization. And I think that it's not always the case, that there are some people who are very high users of emergency services because they have a high level of illness, and they have a high level of need for care, so they come in a lot. No one would say, this person has metastatic cancer, and they seem to be a high user of emergency medical services. It's kind of like because they have a very serious advanced illness. So I think that the important thing to realize is that we shouldn't equate high use with unnecessary or avoidable use. In some cases it is unnecessary or avoidable, but in many cases it's not, and it's often very difficult to distinguish between the two. I think that, and it's easy to kind of, I think there's an attraction to like I guess reasoning by anecdote in this situation. Everyone can tell you a story about someone who came to the emergency department because they wanted a sandwich. That's the classic story that kind of I hear. But I think that when you look, you know, when you look at the issue from a more kind of holistic approach, like, so why is the person here, and does that make sense? It is. It does make sense, and it's not as easy as it. It's not necessarily a goal to reduce all emergency department visits. I think our goal should be to provide better primary care in order to improve people's health, and which actually would, in some cases, reduce emergency department utilization.
Makes me think of that user of the service. They have no other choice. It's a systematic reason that they're
Right.
there. It's not we shouldn't be blaming folks for going because they need their medications reordered and they don't have primary care, or they have an ongoing infection that they don't have primary care that might be more efficient or effective or what have you. But it's not their issue, Maury. It's a systematic issue.
Yeah.
Yeah, yeah.